Hi guys, welcome to my channel. This is MP Digital. I'm a family nurse practitioner. My background is primary care and a little bit of urgent care. Today we are going to talk about acute condition. It's called cellulitis. You have come across this condition so many times. What is cellulitis? Cellulitis is bacterial infection of the skin. It can be the lower dermis, subcutaneous tissue. It's the skin. Okay, skin is the largest organ in the body. All right, so let's dive in. It can happen anywhere in the body. It can be upper extremities, lower extremities, so it can happen anywhere in the body. So medical history that are important to make you wonder, why do connect the dot that they have a cellulitis. Diabetics. If a patient is diabetic, they have hepatitis C, they have HIV, they have history of drug abuse, recent surgery, okay, because there is most likely opening, a cut somewhere because they had surgery, right? And onset and duration. How long has that been going on? Is the redness they have, is it traveling? Is it getting worse? Getting round and round and round? That means traveling. It's getting bigger. Do they have nausea, vomiting? Like, are they vomiting? Do they have nausea? Do they have fever? What is the fever? Is it 103 fever or 100.3 fever? Do they have chills? Any injury, recent injury, splinter, animal bites, dog, cats, even human, right? Insect bites, illicit drug use, like IV drug use. Do they have history of MASA? Those are important questions that will ring a bell. When they present with something that looks like cellulitis, it's going to help you connect the dots, right? What is the status of their immunization? The tetanus, are they up to date? It's very important. A physical exam, you're going to check the vitals, oxygen saturation. Guess what? Sometimes when people have cellulitis, it comes with DVT, depending on where it is, the location of cellulitis. If it's in the lower extremities, sometimes people tend to have DVT, believe it or not. So if you're going to work somebody up for cellulitis, make sure that you get that ultrasound Doppler. If you think they need it, you're going to do your assessment. Do a good assessment, then get a Doppler to rule out DVT, because they have cellulitis, long-standing cellulitis. Most likely they formed a clot in there that will probably throw a clot to the lungs. So pulmonary embolism, which is deadly if it's not caught early. All right. So, like I said, the clinical presentation will be redness, like a streaking. You have like a red line that it keeps going up and up and up. Erythema, like redness. Clinicians that are here, you know what I'm talking about when I say erythema. That redness. Is it traveling? Is it hard? Is it soft? Those are the things that will ring a bell. Is it fluctuance? Is it any induration? Any streaking? Is it spreading to the lymph node, to the vessel? Any drainage? What is the color? Is it purulent, like pus? Purulent drainage. Those are the things that will tell you this is bacteria going on, right? Any palpable crepitus, like subcutaneous emphysema, like you touching it, like it sounds like air underneath the skin. So that should connect the dot that this is something. This is most likely cellulitis. Okay. Any proximal lymphangitis, any regional lymphadenopathy. Do they have adenopathy? Do they have in the closer to where the lymph node? This is a different topic though. Lymph node drains depending on where the injury or the infection is. So if it's up here, is any cervical lymphadenopathy, any posterior or submandibular lymphadenopathy, any people that are not clinicians here. Do you have swelling here? Is it painful, very painful to touch? Or do you have in the thigh area? Is it painful to touch? There are other lymph nodes that is hard to compress, or when you have infection. But it's important to know if the patient is having a fever, chills, and they have that presentation of redness and thick, it's thick and it's tender and it's getting worse, it's getting bigger. Okay. The one that you want to be careful about is My battery is about to die. Mid-facial cellulitis. If it's in the face, cavernous sinus thrombosis, you have to be very careful. Immunocompromised patients, especially diabetes, HIV, cancer, old age, babies, pregnant women. Is it in perianal area? It's complex because of risk for fistula. Difficult to examine. So you may want to send that patient to an emergency room sometimes if you cannot, because you may have to be drained I&D. Okay, there's something they call hidradenitis suppurative. Those are important things to know about cellulitis because they can have complications. Infected sebaceous cyst, you want to consider that too, because they may have cellulitis with that, although they have staph already, massa. You want to be careful. You have to consider, do they have infected lymph node? You think it's cellulitis? So those are the important things to consider. Okay. Normally, group A beta hemolytic strep or cocci is the one that normally causes cellulitis, and it's very painful. It's red, can be on the face and the legs. Sometimes it has a black center. My battery is really low. It has a black center. It like looks like escargot, but there is a disease there is an infection that came out now that's called monkeypox. So you want to differentiate that with monkeypox. Monkeypox tend to have like the center, it tends to be black as well. Okay. What biggest complication for cellulitis is necrotizing fasciitis, flesh-eating bacteria. That's what they normally call it. Okay. Cellulitis with ulcer, like I said, simple cellulitis is just red and thick, but cellulitis with ulcer, it has the black center. Send that patient to the emergency room. They may probably need to be amputated. All right. So what is the treatment for cellulitis? What do you use to treat cellulitis? Like I said, you order ultrasound, right? You may order X-ray just to rule out foreign body as well. What do you treat with? Consider allergy, toxic appearance, sepsis. You treat them with clindamycin. You can use up to 7 to 10 days course of antibiotics, doxycycline, Bactrim, dicloxacillin, vancomycin, clindamycin. Cover for massa. That's the most important. Massa, you don't want that massa, right? Erysipelas, allergies. Those are the things you want to. If it's erysipelas, cover with use penicillin, 500 milligrams QID, 4 times a day for 10 days. Or you can use cefalazine. But cefalazine, if they have allergy, penicillin allergy, you're not going to use that because it's a first generation cephalosporin. For clinicians that are here, you can use clindamycin, 600 milligrams QID. That's 4 times a day for 5 days. Then you can decrease it to 300 milligrams. And tell the patient to follow up 1 to 2 days or sooner. Hospitalize patient if hospitalize the patient, send them to the hospital if they're immunocompromised and you suspect necrotizing fasciitis, especially if they're coming with an ulcer. You have cellulitis, they have ulcer with a black center. Send them to the emergency room so they can be taken care of right away, because they may likely need amputation to get rid of the flesh-eating bacteria. Right? So, what else do I have for you? Clinical pros. You don't want to miss orbital cellulitis. It's very dangerous. You don't want somebody to lose their eyesight. And cellulitis in the hand, you have to treat that aggressively. Orbital cellulitis, cellulitis in the hand, extensive circumferential. Like if there's cellulitis in the hand and it's round, it's already round, danger for amputation. You want to take care of that quickly. Like I said, necrotizing fashion, that one is spread so fast, it's rapid. So you want to take care of that, and it's very painful, and it's red, and it has ulcer in the midsection. I keep emphasizing that. You don't want anybody to come and sue you because you did not treat them well. Management of cutaneous abscess due to cellulitis, right? I&D. You're probably going to do incision and drainage. They use a wick packing, warm soaks, pain management, antibiotics if immunocompromised, if you already drained the person. If they have multiple abscess and cellulitis, you may want to refer the patient depending on your setting. Like I say, perirectal abscess, you're going to refer the patient either send to the emergency room if you cannot I&D in your setting, right? Another thing you want to control is blood glucose if they're diabetic. Fever, NSAID, aspirin, inflammation because of pain, use warm soaks and elevates, right? So this is my acute for you today. Next time I'm going to talk about, what do I need to talk about? Oh, sinusitis. I'm going to talk about bacterial sinusitis. You know, sinus, this is your sinuses. You have infection there, it hurts, it's full, it's painful, you have pressure, your tooth hurts, you lost your sense of taste, sense of smell. That is sinusitis. We're going to talk about that and how to treat that and complications, okay? See you in the next video. I'm sorry I'm talking so fast. Like, share, subscribe, comments, come back. Thank you. Bye.